I provide counseling for families and some young kids, just coping skills, how to deal with different stresses that are going on in their lives, sort of relationship issues with between parents and siblings. We also are starting an aging program where we go out and provide counseling for nursing home clients and their families. And sometimes we provide supports for the staff. You know, if there's behavior issues, how do you handle those behaviors to keep them from occurring so much? Or, you know, when the behavior's going on, what do you do to de-escalate that person? My undergraduate is basically I have sociology and women's studies. And then I went on to get my master's degree in counseling. So that was 2 years at Wayne State. And then because I want to work with the aging population, I need to have an MSW so that I can be covered through Medicare. And so I started out in the social work field, and so I'm going to finish up my MSW, hopefully in the next 3 years. In high school, some of the classes would be helpful. Any human relations classes, psychology, I know that that's kind of a basic one that is helpful. Dating myself, when I went to high school, there weren't a lot of classes that actually pertain to this field. Mostly the family, I think there was a family relations class, some parenting, those were kind of helpful. My typical day here would be I'm just starting out, and so my caseload is pretty small yet. I haven't gotten a large clientele base going. So on average, I have, like on Tuesdays, I'm traveling, so I go to the nursing home, so I have about 6 clients. So that's a pretty full day because I go to Bloomfield, which is a drive, and then see the clients and go home. So I'm pretty tired on those days. Other days, I have about 1 to 2 clients a day. So it's I spend a lot of time reading about the diagnosis that I'm working with, preparing for directions that I want to take that client, issues that we discuss in the session that come up that I need to learn more about. Actually, in rural Nebraska, they really need therapists or counselors, and so there's initiatives to get them to come here. So we have, like, for example, once I'm licensed, I can apply for a federal grant to have my student loans paid back, which is a very nice incentive. So there's a huge need because we don't have a lot of mental health practitioners in this area. So they're trying to get them in, and we don't get paid a lot of money. So that's a nice reimbursement. But it's a very rewarding job. I think it can be. It's also very draining because you're dealing with people's problems every day. So you have to have some pretty strong healthy coping skills. Taking care of yourself is very important because you're the tool. There's a few things that I think are important from my perspective obviously good listening skills. You have to be a good listener. You have to be willing to hear some secrets and be able to know that you can keep that secret sacred and hear it in a very non-judgmental way. So your own personal biases have to be left outside that door. And you have to be pretty comfortable doing that because sometimes you hear things that are like completely not within your own world experience. So being open to understanding someone else's struggle. I think I always enjoyed talking to people about their life stories, and basically I think counseling really is just discovering who somebody is. And I enjoy hearing people's life stories. And sometimes there's little glitches in our stories that we struggle with and we get stuck in, and having that person there to process it with is helpful. And I enjoy that process. I think that one of the challenges of this field is those secrets, and hearing stories that are possibly things that value-wise, they're things that you wouldn't choose to do, or they're things that you've grown up with that are very different, or you've been taught are wrong. And you're hearing these stories about people's lives that you're thinking that most people that come to therapy have been told, you're making bad choices. It's your fault. You're doing these things that if you wouldn't be doing those things, you wouldn't be having problems. As a human being, there's a potential to think that as well, but as a therapist, as a counselor, it is our job to be unbiased. We are there on their side. We are on our client's side. We have to hear it from their perspective. We don't know the reasons that they made the choices that they did, but we have to try to understand it from their perspective so that we can help them come out of their problem. So making sure we leave our biases and our personal life stories outside that door. It's not about who we are, it's about the client. It's about helping them find their story, not our story. In order to be in this field, it's important to kind of have an idea of what you want to do. If you want to do counseling, if you want to do therapy, the kind of population that you want to get into. Like, for example, with me, had I known that if I want to do aging, I would need an MSW, and that the Medicare wouldn't have that issue, I probably would have stayed with strictly social work and not done the counseling and social work, just to eliminate some time. So there is a difference between social work and counseling, and knowing the differences between the fields to make sure that you know what area you're getting into.